Well, I came to work for Northeast Valley in 1974. My classification was the lowest in the organization when I came in as a student intern, and I've spent 35 years, no, almost 35 years, actually 34, climbing up the corporate ladder from intern to CEO. Well, Northeast Valley was actually incorporated in 1971. We opened our first clinic in 1973, and I came to work for the organization in 1974. So I was there from almost the very beginning. Our first CEO was a man by the name of Luis Garcia, and he told me the story, you know, many times of how the local community leaders tried to figure out how they would bring a health center into San Fernando. And our founding fathers got together and said, what can we do about it? And they decided to write for a federal grant. At that time, the Office of Economic Opportunity, in the wake of the Civil Rights Movement, had established a grants program for local communities to apply to have community health center dollars and to set up health centers in their communities. The idea would be that these health centers would be run by community members. People who lived and worked in the community and who were patients of the health centers would help run them. They'd be part of the governance structure. The Community Health Center Board set policy and direction for the organization. Our board members are over 50% actual consumers or patients of our health centers, and they represent the diversity of our communities and our patients. 98% of our patients report incomes under 200% of the federal poverty level, and 75% report incomes under 100% of the federal poverty level. It means that about 75% of our patients have family incomes, family size of 4, of $20,000 or less. So our patients really struggle with day-to-day necessities. A community health center brings them the opportunity to have medical care that they can pay for based on a sliding fee scale. Every time I add it up, it's a different number, but I think we have about 26 locations. We stretch from Santa Clarita to Glendale. We cover a 900 square mile area. So we're a large service area with multiple locations.
La comunicación que uno tiene con las personas acá es como que más familiar. Todos son bien amables y lo atienden bien a uno. Eso es lo que me gusta también. Siempre puede contar uno con ellos.
Ha habido un progreso muy grande, pero ahora tenemos programas para niños, programas para las mujeres que están embarazadas, para los pacientes que tienen problemas de depresión, problemas tan importantes como es la diabetes, la alta presión, el colesterol. Si nosotros usamos la prevención y el tratamiento a su debido momento, podemos evitar incurrir en gastos más grandes. Así que seamos leales a la comunidad y brindemos nuestro servicio porque es agradecido por todas las personas.
The work that we do here is so essential to the people that they are in great need of health care. And it's a big satisfaction, you know, every day when I see how many people we take care of and that we can provide them with the care they need. It's just a satisfaction, personal satisfaction that I, you know, it's a fulfillment that I have.
The HIV program has been going on since 1991. We serve about 600 patients who are HIV positive. We test them, we bring them in, we give them medications for HIV, we teach them how to take care of themselves. We have a dietitian who teaches them about nutrition. We have mental health, teach them how to take care of themselves. HIV was sort of like leprosy. People were afraid of it, even doctors. They weren't being treated like humans, but they needed to be treated like people. So that's the reason I went into it.
The main thing for our move was actually the transportation. I know and a lot of the people that are homeless or living in their cars or living in some, they can't really get to the clinic, so we take the clinic to them.
And this is the actually the lab area, and this is where they do the vital signs. The LVN will have the clients sit here. And then we have the single clients too that also come in and say, you know what, you changed my life by just helping me with my health care needs. you know, and at times they come and say, you listen to me. Just a little thing that you said to me just changed my whole life.
Our WIC program is our single largest grant program, and it serves about 68,000 women, infants, and children. It provides breastfeeding support to new moms. It tackles problems like childhood obesity and getting kids moving. We're constantly looking to our WIC program for innovation in preventive health.
Well, having grown up in the San Fernando Valley and a lifelong resident, it's easy to demonstrate the absolute need for the uninsured and underinsured. And so, you know, one of the main responsibilities of the government is the well-being and the health of its residents. So there's a tremendous need that needs to be met. You know, I got to tell you, my dentist doesn't have a system like that yet. They still use the chemicals.
That's right. So we have a state-of-the-art system.
That's great. I want to thank all of the employees as stewards of the uninsured, underinsured in the San Fernando Valley, but more importantly, or equally important, thank the contributors, because as we're seeing state funding, federal funding constrict and not give the level of service that we need to, that's when we need to have our private funding come in to help and really close that gap. There's a tremendous need in the San Fernando Valley. It's a critical need. All of us want to be healthy, and that's why the Northeast Valley Health Corporation and all of its service delivery needs to be commended and recognized and supported by the contributors and our government.
I think the biggest need, at least from a healthcare standpoint, is to have access to all the types of care that people need. So both primary care and specialty care, I think is very important for patients to be able to address all of their healthcare needs, and I think we struggle on a daily basis to try and meet those needs.
When you are looking at the number of uninsured, which is so high here in Los Angeles County, the main population is the Latino population. Additionally, the safety net system needs to be better funded. Through additional funding, we can increase our capacity. And the best places to do that is in our community health centers. So as far as the uninsured population, the demand definitely exceeds the capacity through additional funding streams and sources. We are so fortunate that so many foundations are out there funding nonprofit organizations, because without their funding, even more people would be left untreated.